I had a full facelift February 2013 with bad results. What facelift will be good for me after having full lift already? I had a full facelift done in February 2013 and spending almost $11,000, but the result was very bad. What kind of facelift will be good for me? Mini lift, quick lift, or a full facelift again?
Thank you for your question. You submitted 2 photos and you stated in your question that you had a facelift in February of 2013. And with the photos you submitted, you are asking what kind of procedure you need in order to improve the results, which you have been clearly not happy with. Now, you mentioned that you had a full facelift, and I'll share with you a little bit of what the definition of facelift is and why it's difficult to always make an assessment based on just the term facelift. Let's begin with just the procedure itself. Looking back at your history, it is important for you to think back and think about whether or not you were happy with the results within the first couple of months after the surgery. Initially, after this type of surgery, if there is improvement of the jawline, the cheek area looks good and the neck looks good, then chances are you had a pretty good result and that there was regression or relaxation. The challenge with facelifting surgery, and this is something I wrote about in my book, The Fine Art of Looking Younger, that I wrote a few years ago, is that the tissue that is sagging, there's 2 critical elements to what causes a face to sag. One is the skin, and as we get older, the skin gets thinner and stretches. And then there's the deeper layer of muscle that's referred to as the platysma and the SMAS. The SMAS is an acronym for superficial musculo aponeurotic system. Now, as I alluded to earlier, was the definition of facelift. Facelift can mean anything from a short scar limited facelift to a facelift incision which goes from the temple to behind the ear. And in our practice, we actually distinguish facelift from face and neck lift. When we do a face and neck lift, we actually extend the incision behind the ear and into the hair so that we can address the bands under the neck as well as the sagging skin. We also typically make a small opening under the chin in order to do something called a platysmoplasty to tighten the muscles. So when I look at your photo, I notice the 2 platysmal bands, and I think there's an opportunity there to do something to enhance the neck definition. This being said, as far as the original procedure is concerned, you may want to discuss this with your original surgeon and ask about what can be done to have you get to the results that you desire. A lot of times, and this is not necessarily applying to you, but a lot of times people want conservative procedures, and then when they have a procedure that maybe partially improves their jawline and gives them about 60 to 70% of the improvement that they maybe in consultation were willing to accept, after it's all done, a lot of times you want more. And that's completely understandable. In our consultations, we actually spend a lot of time discussing with patients the details of what is involved in order to get optimal full correction. A lot of people also misinterpret what the definition of facelift is. Very often they think a facelift includes the brows, where an incision is made on top. They say, I don't want a full facelift. But the reality is that's a brow lift. And a facelift really is defined from the temple, the cheek, and the jawline. And the neck lift for more sagging skin. A lot of times a facelift will address part of the neck or a significant part of the neck depending on how old you are. If you're a younger patient, someone in their 40s and 50s, a lot of times tightening in this direction and tightening the SMAS with a limited platysmoplasty or release you're able to get really nice neck definition without going and making the incision in the back. So, getting to the details of your original surgery, communicating with the original doctor, and if that isn't an option, then ultimately you're better off than going and meeting other surgeons and having a physical examination. I find that when I do revision facelifting surgery, particularly when it's done by some of these people who do mini procedures or shortcut procedures, and they only end up with bad scars and pixie ears and things pulled down and not looking good at all, I end up doing the full proper face and neck lift regardless of what their operative report states or the information they provide, because a lot of times it just really doesn't make a difference when we are actually in surgery. The decisions are made real time during surgery with some projection and anticipation prior. So it looks like you probably are a candidate for either an enhancement from your original procedure or a full face and neck lift based on the photos you submitted. The one thing I can't do is do a physical exam and actually feel and examine and tell you how much tension there is and what the realistic expectations would be. Also understand that no matter who does the facelift, no matter how well it's done and how technically proficient the doctor is, there is always a certain amount of relaxation and elasticity. When you turn your head and lift up and down, the skin will stretch, the tissue will stretch, and as we get older, that tissue becomes more stretchable. So that's a factor that also has to be added into your decision-making process. So to summarize, I think you would probably be a good candidate for a face and neck lift. Enough time has certainly passed to allow for tissue swelling and other factors to have resolved. I would recommend you meet with your original surgeon and see if you can resolve this issue. If that's not a viable choice for you, then meet with additional doctors and consider the options of having a face and neck lift. And as a final thought, I would say avoid shortcut mini procedures. They tend not to work when you have that much platysmal banding and the amount of relative sagging that you are demonstrated in your photos. So I wish you the best of luck. I hope that was helpful, and thank you for your question.